Have you heard about the 6-part case study questions on the NCLEX? Do you know what they are and how to answer them? Today, we're going to be talking about the NCSBN 6-part case study. First of all, it is important for you to note that all case study questions on the NCLEX will follow these exact formats and order. So here's how it works. You get a scenario, a case study, and you're asked 6 questions in this specific order. So your first question would always be about recognizing cues, also known as what matters the most right now. The first step is identifying the most crucial cues in the scenario. So, for example, think about the first thing you notice in the case study. So the vital signs, the symptoms, are there any distress? This will be your starting point. Now, your second question will always be analyzing cue. Here, you are looking for why. Why are the cues you identify in question 1 significant, and what could they indicate? For example, you notice the patient's elevated heart rate. Does this signal dehydration or heart issues? It is important to look for patterns. Now, your number 3 question will always be prioritizing hypotheses. Here, think what is going on and where do I start? Decide which problem needs to be addressed first. For example, if your patient is in respiratory distress, that is the priority over something less urgent like a headache. Number 4 question will always be generate solution. Here, think what can help or what may not help. Okay, your contraindication. You want to develop solutions and consider the possible contraindications as well. For example, a patient with low blood pressure, be cautious with medications that could drop it further. Also, always consider their history. Now, your 5th question will always be taking action. Think, what are we going to do based on your priorities? So this is the moment where action happens. For example, administering oxygen, repositioning the patient, or giving prescribed meds. Take the necessary steps based on your priority. And finally, your final question, number 6, will always be evaluating outcomes. After taking action, you want to evaluate the outcome, don't you? The intervention work, what needs to change? For example, administering pain medication, right? You want to check on your patient to see if the pain decreases. If not, you might want to adjust your approach. And there you have it. If you have any more questions regarding nursing school or the NCLEX, ask them below in the comment, and make sure to head over to my website showing on your screen for resources to help you pass the NCLEX and nursing school. Bye, and I will see you next week on our next series. Mwah.